Hi, and welcome back. We have with us today Dr. Calli Thompson. So we're just going to jump right back into our questions. So we have a question in regards to animals excessively grooming, licking out their hair. What kind of behavioral issue would this kind of signify?
Well, it definitely can be behavioral. That's one of the things that we would look at. But it also can be an indication of more of a dermatitis or an allergy-related issue. So sometimes it's actually not them being bored or having an obsessive compulsive type behavior. Sometimes it's because they're itchy or their skin is sore and uncomfortable in those areas. And it really actually becomes quite challenging to tease those two things apart. But it's not an uncommon thing for an owner to notice about their pet, but something definitely that you want to address with your veterinarian. Because even if it is behavioral, cats and dogs can groom to the point where they're actually starting to damage their skin. They've pulled out all the hair, and now their skin is becoming raw and inflamed. And if they're breaking open the skin, they can get really bad secondary infections. So regardless of the cause, and trying to figure out the cause is always the first thing you try to do. But it is something you'd want to address. So fairly significant, although it seems like a funny behavior, and something to talk to your vet about for sure.
So if it's an allergy, are you going to notice a rash along with it, or?
Not necessarily, yeah. Allergies in people can be all over the board, as they can with animals. And so, no, you can have a cat or a dog that's really, really itchy. And sometimes the first symptom of that is just itchiness. It's no change whatsoever within the skin. So just because there isn't a rash there doesn't necessarily mean we can exclude an allergy as one of the possible explanations.
Okay. Next question is also from a viewer. So she wrote in that she has 2 male cats, both under the age of 3. One was recently neutered. The other one is a female cat, about a year old, also fixed. And the 2 male cats are stalking and pouncing on, rather aggressively, the female cat.
Yeah, it sounds like a very interesting and odd situation. So sometimes that behavior can be play behavior. Animals are very playful, and it could be play. But my other concern would be that it's a dominance behavior or more of an aggressive behavior. And really, without being able to actually observe the cats doing it and how often it's occurring, and really talking to the owner about what are some of the other things that she's seeing within the house, trying to differentiate play from more aggressive and unwelcome behavior becomes a really big challenge.
So how would you stop aggressive behavior like that if that was the case?
Yeah, so that's really a challenge to do, and something that probably that owner needs to work with someone who has training in behavioral medicine, whether that's a veterinarian or a non-veterinarian who has taken training and educational courses in behavioral management. The one caution I give to a lot of owners is I think that in a lot of cases we have an unrealistic expectation that we can put a whole bunch of animals, even 2 or 3, under the same roof, and they're all going to get along and kind of have the same personality. And that's unfortunately more often than not the case. There are a lot of pets out there, cats and dogs alike, that are single pet household animals. And what I mean by that is that they really don't do well because they're very timid, or because they're really playful and boisterous and can be annoying to another cat or dog when there's other pets around. And that can lead to conflict between those 2 pets, and that conflict can then lead to some really unwanted behaviors like destruction of furniture, inappropriate litter box behavior. So instead of using the litter box, starting to urinate or defecate outside of the litter box because we're stressed and anxious and we don't feel safe in our own house. Those are things that we can see when we have behaviors that are unwanted by one animal or the other. And when there's kind of a lack of cohesiveness in the home. So definitely something that if it's a new behavior or it's something that is bothering the owner, is something to address with their veterinarian. And even if that veterinarian themselves can't solve the problem, they could at least steer them in the right direction in terms of what are some other resources out there that could help them with behavioral modification and retraining.
Right. So you mentioned the litter box issue, and that was actually another question that was submitted to me, was someone's cat is not going inside the litter box, is going regularly just on the outskirts of the litter box. Single cat household, and just started doing this, clean litter box.
And unfortunately, that's not an uncommon kind of presentation to see, that one day everything's okay and then all of a sudden it's not. And there doesn't really seem to be a good explanation for it. As we addressed before, it definitely can be behavioral. Like there's something that I'm upset about or I don't like about, or there's been a change in my environment. And cats are famously very sensitive to stress. But the other side of that coin is it also can be a medical reason for it to be occurring, whether they're associating pain with going to the bathroom because there's something painful about going to the bathroom, whether that's in the urinary tract or whether that's in the intestines. But it also can be a red flag, as we've talked about with other behaviors, that maybe there's actually a medical reason underlying why it's occurring. So very common thing that we see and get asked, and very important to meet with your veterinarian to talk about it, because if it's medical, the underlying medical reason needs to be addressed to be able to improve the behavior. Versus just trying to punishment of the cat or those other things that if we don't address the underlying cause, we're really not going to be successful in addressing the behavior.
Okay. Question, how often should my dog be exercised? We're not talking about my dog because we know about my dogs, but on average, how often should a dog be exercised?
So I think a daily basis is a very simple, great answer. You and I probably shouldn't and wouldn't be healthy for us to sit at home all day and watch TV or sleep on the couch. We need to get out, we need to move around. Do we need to run a 5-kilometer race every day to be healthy? Probably not, but we need to move. We need to get our hearts pumping and our legs going. And so that applies to animals as well. Some dogs do better with multiple short walks, or maybe the owner's lifestyle is such that they can't commit to doing, a full hour or a full 2 hours outside every day, and that's okay. But I think a good principle is to get out and move absolutely every day, even if it doesn't seem very far for very long. Something is always better than nothing when it comes to exercise.
Great, perfect. So we sort of talked a little bit about this the last time you were on the show, but how important is dental health to my pet, and what are some preventative options or methods?
Great question. Yeah. So more so, I think all the time, we're recognizing that oral health is absolutely critical to the overall health of our pets. And I think that as a veterinarian, it's probably the area of health that is overlooked on a regular basis. Not many people walk around looking in their cat's mouth or looking in their dog's mouth, and that's really understandable. But it doesn't in any way negate the fact that oral health has been linked to serious issues with lungs and respiratory disease, heart disease, as well as kidney disease. So there's a lot of things that can show up later on in life that, looking backwards, can actually be tracked back to poor oral hygiene. In terms of addressing what are some of the preventative measures, that's always what we want to do. We want to start out with healthy, clean teeth and try to keep them that way for as long as possible. So probably the best from a scientific standpoint, but that isn't always practical, is to brush your pet's teeth, okay? Yeah. And as I said, we can kind of laugh and snicker about it because it's not reasonable for every animal or for every pet. But just like you and I, it is the best thing that we can do to keep our teeth clean and healthy. Probably the next step from there would be to look at, well, if I can't get in there and brush, is there something I could feed my pet that they would enjoy that would actually help to clean their teeth? And we talked about apples before for you and I. They say apples clean our teeth. There are dental treats and dental food that has been designed in a way and formulated in a way that as the animal chews on them, it scrapes the plaque and tartar and bacteria and food particles off of their teeth. So other than brushing, that's probably the second or next best thing we could do preventatively.
These are those hard dent-to-bones, right?
They have many different names, and I think finding one that's safe. So one of the challenges we run into with a lot of these chew treats or toys is that some of them are actually so hard that they can break the teeth, and that's not what we want.
Wow.
We don't want something that hard that is going to mean, hey, your teeth are clean, but now you've got to go in for a root canal because you've got a fractured tooth. So really, again, addressing it with your veterinarian about, is there a list that you can provide me? And there's some very good resources out there that we have as veterinarians that we can direct our clients to that, one, have been scientifically proven to be really effective, but number two, are not too hard that they're going to actually maybe damage the teeth or damage the mouth in any way.
Perfect. Well, I have a lot more questions for you, but we're coming to the end of our time. I wanted to talk to you about after-hours care. So emergency after hours, because a lot of people don't know who to call or how to reach a vet in an emergency. So
yeah, so really great question for us here in Thunder Bay. Because we're a fairly isolated and smaller community, we don't have a hospital in Thunder Bay that is open 24 hours a day. So somewhere where at 2 o'clock in the morning, if you end up with an emergency, there's someone at a hospital waiting for you. But what we do have available is every veterinary practice in our community has to offer emergency and after hours care. So that is those 2 o'clock in the morning situations. Okay. So one thing I always encourage pet owners to do is know ahead of time, before you get yourself in any type of emergency situation, how you seek out those emergency services.
Okay.
And so talk to your vet in your vet office about, if I ever needed someone in the middle of the night, what would I do? How would I get it? Where would I go? And they can direct you accordingly. If something arises in the middle of the night and you haven't had that discussion, most of our veterinary hospitals have answering services.
Okay.
So maybe not someone live on the phone to take the call, but someone to direct you to where to call to get in a hold of a veterinarian who can then help you out with whatever emergency you're having.
Perfect. Okay, well, that's the end of our show. Thanks so much for being here with us again today. We're going to have you on the show again because
You're very welcome.
I have a lot more questions for you. But
Excellent.
thanks for being with us.
Thank you for having me.
Stay tuned. We'll be right back.